So another thing, as I mentioned, Botox and Xeomin is FDA approved for migraine headaches. So if you have migraine headaches, this can be approved as a medical treatment. So talk to your doctor, talk to your primary care provider and see if this can be approved by your insurance. Your insurance can cover it because it is a medical treatment. Another thing that Xeomin is approved, which is good, it's not just aesthetic treatment. So it can treat migraines in all over the body. Sometimes people can start that trigger point in their neck, it can go in their heads. This Xeomin is FDA approved to treat all this pain or muscle pain, and we can treat different areas, just the back of the head, the neck, not just the face as an aesthetic treatment. Xeomin is one of the 5 brands that is FDA approved here in the US, and the most common one is Botox because it's Botox, the brand that contains the Botox. But all of the Botox treatments are including the same botulinum toxin type A, and at the same time it's just that they have different names, and most of the time is they're FDA approved for the same period except Daxxify. Xeomin is FDA approved for 3 months, and depends on the areas where we're treating. Sometimes it can last a little bit longer, it can last a little bit shorter. Another study that it's done on Xeomin is that if you add more units, it can last actually longer. So if, for example, it was FDA approved for 20 units in the glabella, we can add up to 60 units and it is gonna last a little bit longer. However, here it becomes more on the look that we're trying to get. Here at SYA, we always go for the natural look, and it always depends on the strength of the muscle and how we're gonna emphasize your face. There are other Botox approved like Daxxify that it's supposed to last the longest. So Daxxify is the FDA approved for 6 months. Some patients complain or mention that Botox doesn't last enough. And that can be not only with Xeomin, it actually can be with different type of Botox because the patient metabolism is fast, or the patient exercise daily, or their daily activities. For example, they have a dance school and then they teach dance classes the whole day. They're exercising and they're moving their muscles the whole day, so they metabolize Botox faster. So even though Xeomin or any Botox is FDA approved for 3 months, their Botox is not gonna last as long as 3 months. It's gonna metabolize faster and it's gonna be a month or 2 months. Same thing for if we add more units. Sometimes adding more units relaxes the muscle that it lasts a little bit longer. However, it creates also that frozen look that we don't want. So instead of telling the patient don't exercise, continue with your routine, exercise, we'd rather do it a little bit more often than doing a lot where we're still gonna metabolize it faster. There are different Botox approved. For example, Daxxify is FDA approved for 6 months. How I seen it is that it lasts longer, but it also correlates to the patient. To the patient's metabolism. There are some patients that metabolize Botox faster. So if general Xeomin or general Botox treatment lasts on them 2 months and you have to do it again, then Daxxify is gonna last double the amount of that, so 6 months. In general, FDA approved, Botox Jeuveau, Xeomin, this sport is FDA approved for 3 months, and the only one that is approved for 6 months is Daxxify. It should last around that amount. Sometimes it's less, sometimes it's more. Anything that we can do to make the Botox last longer is 2 things. One, we want it to be consistent. So because the Botox is FDA approved for 3 months, you wanted to wait for those 3 months, see that the movement comes back, and then get again another Botox treatment. You don't want to wait until the wrinkles are completely back, because then we're going to start from zero and we have to add and then do the treatment again. But as you are consistent, you're gonna see that the muscle kind of like forgets how to contract in those areas, and it's gonna last a little bit longer. Because the idea is not to freeze or paralyze the muscle completely, it's just to relax enough so the skin can grow smooth, and then we can do it either less units or we can do it less often. And then the second thing to make Xeomin last a little longer is to maintain your skin. So once the muscle is relaxed, we have to work on the skin. The skin regenerates, and if the muscle contracts and creates the wrinkle, the skin is also gonna grow like that. So we have the Botox treatment, we have the Xeomin treatment, relaxes the muscle. Any treatment that we can do on the skin is going to improve, and it's going to help us get the treatment less often. We can do that with facials, we can do that with like little chemical peels, microdermabrasion, just like maintain the skin at home with your cosmetic products, just so the skin regenerates nice.